Hello friends and colleagues, I am Dr. Scott Schmidt, and I sincerely hope this message finds you well as we continue our journey of helping others through oral health care. I wanted to comment today on complete denture therapy and the use of dental implants to improve the patient experience. Despite modern advances in our overall dental treatments, edentulism is still a significant issue for many of our patients, particularly our aging population. How often do we hear someone accept the idea that they're going to lose all of their teeth simply because their parents did? Although they watch their parents struggle with an ill-fitting denture, they often resign themselves to a similar fate. To place perspective on this issue, I'd like to reference an article produced at McGill University in Montreal in 2002, so more than 20 years ago now. This well-known and often supported consensus opinion stated that a complete lower denture should no longer be the standard of care for lower edentulism. The minimum acceptable treatment option for most people, based upon performance, patient satisfaction, clinical procedures, and cost, should be the 2-implant overdenture. Now, in our current internet culture, most patients are certainly aware of dental implants. In my experience, most believe them to be significantly invasive and very expensive. They've heard the extremes of full arch implant care or online horror stories of implant failures, but they're certainly not educated in the scope of implant options. It's our role and our responsibility as their primary oral health care providers to educate our patients about the appropriate resources for their specific condition. 2 implants supporting a lower complete denture should ideally be the minimum care we propose, and we should educate them on the reasons why. We should feel quite comfortable that this is not some kind of a sales pitch, but an ethically based recommendation backed by our dental literature. Again, we in the dental community need to educate the general patient population on this important fact. Now, I certainly agree and appreciate that taking time to have difficult conversations in the midst of a busy day is never convenient, but I would like to suggest that making this concept more universally accepted is well worth the effort. Performed properly, it is certainly in everyone's best interest, and I'd also like to suggest that implant support is not an excuse for poorly fabricated removable prosthetics. Denture protocols and procedures should be well followed to give our patients an excellent outcome, and the cost that they're investing in the implants only makes this point more relevant. So I hope this entire idea makes sense and only helps you to help your patients today. As always, I and Dr. Al Ramos are always here to support you in your practice for those needing a prosthodontic referral. I wish you all my best.